Michele Perez with the Resurgence Spine Center, and welcome to our next episode of our podcast, Back Talk. I'm here with Dr. Reuben Sloan, and we're going to talk today about home remedies.
Hello.
Hi. All right, so home remedies. We're going to talk about just simple at-home things that patients can have access to help with, to relieve pain when they, either before they get in to see us, and or even in between visits with us, right? So I usually tell patients, so they say, if I have an episode, what do I do? So I kind of go through a litany of things that they could do at home to help themselves. So rattle off a list.
There's so many things that you can do at home before you come see a doctor.
And maybe avoid seeing the doctor.
Right. So most orthopedic issues, spine especially, are muscular. There are strains or overuse injuries, and usually ice is very helpful. Mm-hmm. Icing an area that's sore will prevent it from bruising if there's any blood that's going on deep inside. It'll help the muscle from contracting and causing spasms. Heat is sometimes helpful.
So let's talk about how often people should use ice.
Yeah, so 20 minutes on, 20 minutes off is what we say. After 20 minutes, ice does very little. So you can just give yourself a break and you can repeat as necessary. There's no wrong or right answer. You can do it 57 times if you want. Mm-hmm. You can't ice too much unless, of course, you have a condition where you have cold intolerance like Raynaud's. But short of that, there's no reason why you can't over ice.
And just being careful with the skin.
Now, I get asked what's the difference between heat and ice. Mm-hmm. I tell my patients in a nutshell, if you have baseline pain and your pain shot through the roof, you got to think of that as an exacerbation or an inflammatory reaction. Mm-hmm. And we want to calm that down. So ice is better initially, like we just talked about. Mm-hmm. But after 72 hours, you can switch to heat. Right. Or if you just feel a little tighter and it's not a huge flare-up in pain, you can try heat. A lot of people now have heated seats in their cars. Right. It's cold outside right now because it's January, and I have mine on, and it's very soothing.
It is.
There's lots of other things you can do. Anti-inflammatory medications. People often get Tylenol confused with the anti-inflammatory category. Tylenol is not really an anti-inflammatory.
So that's also called acetaminophen.
So
when you buy it over the counter, it's called acetaminophen.
And most stores have their version of it, Walgreens or CVS or anybody else.
And there's now different strengths of Tylenol these days. There's the extra strength and now the arthritis strength, which is 650 milligrams in each tablet. And the extra strength is 500. So it's just a little extra juice in there.
Correct. And those are mild pain medicines, but they certainly have value. Anti-inflammatories are things like Aleve or Advil, or naproxen, which is Aleve, and ibuprofen, which is Advil. And those are very therapeutic because they help reduce inflammation. And again, a lot of times acute pain is due to some form of inflammation, and a combination of taking an anti-inflammatory with food in your stomach and ice is very, very therapeutic. If we're talking about an extremity, elevating the limb so it doesn't swell is helpful. There's just a lot of things you can do before you even come in. If you have an ACE wrap and you're really uncomfortable, or a back brace, you can put that on to help protect your back from moving until you're able to come in and see us.
Yeah. So patients often have a lot of questions about medications. So there's Tylenol, which we just talked about, NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, Aleve, and naproxen that are all over the counter. And then, of course, there's prescription ones. So some patients can't take NSAIDs, right, because they're on blood thinners or they have major heart problems or major stomach problems. So they have to be very careful with those. So they often have to rely on Tylenol instead. But if patients can take NSAIDs and they're healthy, we do find they're a bit more effective. Wouldn't you agree?
Absolutely.
I mean, they're more potent from a pain relief standpoint, but you have to know that you're safe to take those medications and follow the instructions on the bottle.
Right.
So
Some other home remedies. So a lot of people will get on Dr. Google and will start looking up stuff. I would not recommend doing exercises because you can actually do the wrong exercises and make your pain worse.
I've seen that
So I
happen.
really wouldn't call that a home remedy.
Right.
But some people are prone to do that, or they've
Right.
tried exercises and their pain is worse.
Right. Because you don't know what those exercises could be for. They call it sciatica on Dr. Google, and they're doing some kind of wacky exercise that makes them 10 times worse.
Right. And that's,
We should be directing that.
Correct. And that's where a therapist really makes his or her keep. They tailor fit the exercises to match the individual's issue at that time. And getting exercises off the internet just doesn't do that. It's not. I tell my patients it's like buying something off the rack and just grabbing a dress or a suit off the rack, not looking at the size and expecting it to fit.
Yeah.
The chances are not high that it's going to fit.
True. Very true.
And I'm talking fitting perfectly,
Right.
having it tailor-made.
Right.
A physical therapist is analogous to a tailor-made suit or a wedding dress that's fit and refit in multiple times and fits perfectly on your wedding day.
Exactly.
So, exercises would not fall into that category.
Sure. Good point. That's very important. So other things that are over-the-counter, patients can use all these topical medications that are available now, tons of them. Old school was Bengay.
Yeah, so that has a role. Bengay and a lot of the analgesic or pain-relieving topicals have menthol in them. And they have
cool and warm at the same time, sort of this weird feeling.
Right. They have salicylic acid, which is basically aspirin.
Right.
So Aspercream is a famous one. And then there are now anti-inflammatory topicals like Voltaren gel.
Right.
And there are lidocaine patches.
Right, which used to only be prescription.
Right.
Now are available over the counter, just 1% difference.
Correct.
In
So
the dose.
it's less potent.
Right, but not by much.
Those have a role. I'm a very big fan of the anti-inflammatory topicals. I think they have a huge role in treating yourself when medications that are prescription strength are not available, or if you have a slight injury that doesn't warrant something as powerful as a prescription strength medication. Mm-hmm. Those medicines can be used 4 times a day. Most people don't realize how frequently they can be used.
Right.
And it's a way to get inflammation controlled readily, and it doesn't get into your system, so it doesn't cause any trouble with people who have issues with stomach problems and can't take traditional tablet anti-inflammatories.
Sure, exactly. So what else? So now I remember when we started practicing, TENS units were not available through or over the counter. They had to be purchased through a vendor or rented through a vendor. And we used to have the vendors come in the office and have all these TENS units. So they're tell me again what TENS stands for.
Transcutaneous neuronal stimulation or something close to that.
Something like that.
Yeah, so they have a role. So what they do is they trick the nervous system into processing the information, the electrical information, which is a low-level electrical current, from the unit rather than the pain. So when you bang your elbow against something and you rub it and it makes it feel better, what you're doing is you're making your body process the nerve fibers that correspond to pressure and touching, and it turns off partially the pain nerves. So that's the way a TENS unit works. The problem with the TENS unit is once you take the thing off or the battery dies, the pain comes right back.
Right.
But it is a nice way to control pain temporarily.
Right. Easy to use, little pads that stick on your skin.
Correct.
And you turn this little box on.
Now that it's available without a prescription and it's readily available on the internet, it's inexpensive.
Yeah, and it's very safe. I mean, patients are worried that they might hurt themselves. There's really nothing you can do to hurt yourself with one of those. I just tell patients to put it on the soft parts, not the hard parts. Don't put it on the bone because that won't feel great, and that's not where you need to target. And you just don't turn it up too fast because it doesn't feel great if you turn it up too fast.
Your muscles will start twitching. What about supplements like turmeric and all of these other things? What are your thoughts on those?
I don't really recommend a whole lot of that stuff. Is to tell people the only thing that anecdotally, I mean, I haven't done any deep dive research into turmeric, but anecdotally patients report that it works. So I think it's safe. Why not? I don't have any problem with it.
Explain what you mean by anecdotal.
By patients just telling us their stories. This worked for me or this worked for my friend, and I did feel better when I started this.
No scientific backing to support the claim that it works.
Right. And nobody knows, right? Because supplements are just too there's too many of them. And problem is, if you take too many of them at one time, what's working and what's not.
Right.
So
and then do they interact with your other medicines you're on?
So only supplement I'll ever really recommend. I don't recommend it. If patients ask me about it, I'll say turmeric is the one that I hear the most success with from patients. And then CBD creams and stuff, I've heard good result. I don't have any research evidence or clinical evidence on that either, just from patients.
Right.
So,
agree.
Yeah. But that's, again, it's just medications. There's just a finite number of them. I feel like supplements, it's an infinite number, so it's really hard. Like, which CBD topical do I use? I don't know. I mean, there's just too many of them.
Right.
Which brand of supplement do I use? I don't know. It's just because it's so unregulated.
I always tell my patients if they're thinking of getting supplements to really read the labels, and almost universally it'll say this product has never been studied or approved by the FDA for the treatment or management of any condition.
Right.
And a lot of times these things are being sold for particular conditions.
Right.
So we have to be careful with that.
Yeah.
Because the science is just not there.
Yeah.
So what about bed rest? I'm sure you get asked a lot. If I hurt my back, should I just lay in bed or should I get up and move? Should I move to tolerance? What should I do?
Generally, if patient's pain is pretty intense and acute and they are really struggling to move, then yes, relative bed rest is good for the first 48 hours or so. I say relative, meaning not completely, should get up and move around as best as possible, but spending more time lying down than getting up for the first couple of days, which just sort of lets the muscles relax, lets the nervous system calm down. But after that, we know that bed rest doesn't really seem to promote any healing, and patients start to feel worse in a way because they're getting stiff, they're getting tired of laying down all the time, and getting up and moving around starts to actually feel good. So relative bed rest for a very short period of time, a day or two, is usually all I recommend. And then some people actually don't do really good with bed rest at all. So we know that people with acute disc problems or herniated discs, they can't sit. They actually end up spending most of their time walking around. So I tell them, go for a walk. Just walk around the block because walking is going to be therapeutic. So it kind of depends on the problem. Let pain be your guide, right? Let your body tell you what to do.
And then patients will ask, should I lay on my back? Should I lay on my side? Should I lay on my stomach? What do you tell them?
First of all, wherever feels comfortable, number one. But we do also know that some patients with acute disc pain in their back will do well by laying on their stomach, either just on their stomach or with a little pillow under their belly, because we'll get them up on the table for a procedure, and that's the most comfortable position they've been in, and they hadn't thought about doing that because nobody really thinks to go on their stomach for a back problem. So if that helps, do it. If it feels bad, don't do it. I tell some patients to lay down on their back and put their legs up at 90 degrees, like on a bunch of pillows, or lay on the ground and do that because that flattens out their back, and that sometimes feels really good. So whatever feels right is the way to go. Is that what you tell them?
That's exactly what I tell them. I tell them whatever's comfortable for you, that's the position you should default to. Mm-hmm. A lot of my patients are older, so disc herniations are not necessarily what's wrong with them. It's usually more spinal stenosis or for those that don't know what that means, the bones will start to grow bone spurs and it starts to narrow the canals and the nerve starts getting pinched because of that. So they tend to like being in a fetal position or on their side where they're flexing or curling up because it opens up those canals.
Right.
And what you alluded to with people lying on their stomach and it helping them when they have back issues due to herniated discs, we believe it moves the disc forward away from the nerve that it's irritating, and hence it's therapeutic.
Yeah. So sometimes people will figure it out on their own.
Correct.
They're like, I figured out if I lay on my stomach, I feel better. Is that okay? Absolutely. If it feels okay, your body's telling you that's okay.
Right. And I agree. I tell my patients, no more than 48 hours. I would rather them try to get up after 24 hours. A body in motion stays in motion. A body at rest stays at rest. And we don't want to promote too much rest because you're going to hurt when you try to move, like you said, and it's just going to do a lot of other negative things to your body.
Yeah, we know how fast muscles atrophy, and and think about if you're sick and how terrible you feel after laying in bed for a few days. You feel awful,
right? Because
our bodies are not meant to do that. We're forced to sometimes, but you're right. Moving sooner than later is better. Never more than a couple of days.
All right. So in summary, anti-inflammatories, Aleve, Advil, ice or heat.
Right. And heat
Default
can be heating pad.
heated seats in your car.
They have all kinds
even
of fun
like, you know-
things at the store you can buy with
Right.
like massage chairs
A
and
lot of
heat
people
in
have
them.
jacuzzis with, have bathtubs with jacuzzi jets.
Right.
Those are very therapeutic. It's basically massage.
Saunas.
Saunas.
Big thing now.
Yeah.
Yeah.
So that's heat.
Yeah.
A back brace if you have.
Yeah. So back brace. People ask a lot about back braces. What's your take on that?
Yeah. So I'm a fan of it as long as it's not used too much. So I tell people to put your body, put it on if you're really uncomfortable, and if it hurts to move, it helps bind you and it helps give you core strength while you're ailing. But the minute you start feeling better, wean yourself from it or come out of it entirely, because it's going to promote muscle weakness.
Right. You don't
and
want
we
to
don't
become
want that. That's
dependent
counterintuitive to what we're trying to do.
Right. But they are very useful. They've been demonized, I think, over time about
Correct.
don't ever use them because they're bad.
Right.
I think we're coming back to the middle where we realize that they do have great utilization by patients, but we don't want them to be dependent on
Right.
them because they can lead to core weakness.
For sure. And prophylactically, they have a role. So I tell my patients if they have one and they're going to do a lot of gardening, they're going to rake the leaves outside in the fall, put it on.
Yeah, really
But
does
make
protect
sure you
them.
take it off when you're done so that you don't get used to being on it. I wear a lead apron, and you do too when you do your spinal procedures. The thing weighs 12 to 15 pounds. I have a belt that helps take the pressure off my shoulders of that heavy lead pulling down on my shoulders. So the braces actually have some prophylactic uses too.
Yeah, absolutely. I think that's pretty much it that I can think of. Can you think of anything else?
I don't think so. I think we covered it all.
Okay. All right.
Thank you.
Yeah. Thank you for joining us.